Hello everyone, my name is Nalton Lekimba. Today I'm going to talk about venous ulcer. Venous ulcer, I chose this subject because I didn't know what venous ulcer was. None of my family members knew what was venous ulcer. We think about venous ulcer as a curse, in Africa basically. And it's something that really impacted my family, especially my grandma who suffered of it twice. And unfortunately passed away last year. So that's the reason I really want to talk about venous ulcer, to educate those who do not know, or teach those who do not know what venous ulcer is, and to put away those mentality of venous ulcer can only be treated as uh, treated traditionally. As well, in America, a lot of people don't know about venous ulcer, especially old adults. They usually miss to detect this disease at the earliest stage, and then it usually end up by forming up. So that's the reason we're going to talk about venous ulcer today. Definition of venous ulcer. Venous ulcer are open skin lesions that occur in the area affected by venous hypertension. Venous hypertension is defined as increased venous pressure resulting from venous reflux or obstruction. The prevalence of venous ulcer in the United States range from 1% to 3%. In the United States, 10% to 35% of adults have a chronic venous insufficiency, and 4% of adults 65-year-old and older have venous ulcer. Here I have a video that I would like to show you, just to reinforce that venous ulcer it's a real disease to take in serious. Here, take a look.
I'm Dr. Joan Warren. I've been in private practice doing phlebology, the branch of medicine that deals with veins and diseases of the veins, for over 13 years. What are venous ulcers? Ulcers, often painful, are wounds usually located by the ankles that are caused by abnormal pressure from diseased veins that cannot adequately transport blood back to the heart. Venous reflux, as can be found in deep venous insufficiency or superficial venous insufficiency. They are the major cause of chronic wounds, occurring in 70 to 90% of patients with chronic wounds. If an ulcer is in part or completely due to superficial venous insufficiency, treating the underlying superficial venous insufficiency can reduce the pressure and cure the ulcer. This can also prevent recurrences.
Now, let's talk about the risk factor of venous ulcer. Is 55 or older is at risk for venous ulcer, or Mbasu, like it's called in Africa. These also include family history of chronic venous insufficiency, higher body mass index, superficial deep venous thrombosis, higher number of pregnancy for women, physical inactivity. Let's talk about the sign and symptom of venous ulcer. Symptoms of venous ulcer include limb heaviness, pruritus, pain, and edema that's worsening throughout the day, and improving with elevation of your lower extremity. Here where I will try to establish that difference of perception of venous ulcer view from Africa, especially for those who from Republic Democratic of Congo, and to the medicine. So in West medicine, venous ulcer treatments include conservative management. In conservative management, it's going to be compression therapy. Here, you start developing the sinus and you develop the sinus symptom of venous ulcer. You are aware of it, and then the provider the provider will give you some compression therapy, which is the standard care of venous ulcer. It is recommended at least 1 hour at least 6 days per week to prevent recurrences of venous ulcer. If the wound is already there, they're gonna use a dressing. Dressing is gonna be recommended to cover the ulcer and promote the moisture or wound healing. And then we're gonna have medication. Medication, it's antibiotic. The antibiotic will be provided orally if infection is detected. If you develop like an advanced wound of venous ulcer, so they are going to provide advanced wound therapy, which is they are going to go really, really deep, such as debridement. Debridement is a benefit for the healing of the ulcer. For those who are not familiar with the word debridement, they're going to take you to the surgeon. They're going to take you in the operation room. The surgeons or whoever qualified to do it, it will take off all the dead tissue on your legs. If you have developed your venous ulcer on your legs, it will to take off all the dead tissue and leave your wound with the good tissue, so they can promote a good healing. I'm staying here, and I'm like I say, I'm gonna compare with African perception of treatment of venous ulcer, because they have a different view of it. Like I said in the beginning, in Africa, it's seen as a curse. So each patient must be treated. Here we treated individually by considering their culture. This is important because some cultures have differences belief in certain disease. Healthcare professionals must develop cultural awareness in order to provide a better care to patients who is culturally diverse. Being culturally aware allows the healthcare professional to build a trust with their patients, and sometimes Africans sometimes have a mistrust to the United States healthcare system due to the past history, So here, you see that background of culture is playing an important role. So as a healthcare provider, you have to be aware of that. And then in Africa, this is where I'm going to share you my personal story. My grandma, it was in this stage where her wound was developed. It was like advanced wound, and they needed advanced therapy. So as it was treated, traditionally it didn't work because it was the recurrence of the venous ulcer that we didn't know. So we go to the Western medicine, and then the provider provide a debridement treatment, which really helped my mom going over, but it was already late because the wound was infected from the traditional treatment, which required a lot of antibiotic. But unfortunately, my grandmother immune system wasn't able to fight the infection during the traditional treatment, so it was already late, and then she passed away, unfortunately, last year. So just to say too, it is important when you, as a healthcare provider, it's important, or as not even a healthcare provider, it's important to be aware of those differences of people who are developing different disease. It's very important, because don't just judge. You don't know how they're seeing the disease. So that's where I'm going to advise you. It's better I'm going to advise you by telling you use the preventive option, like to prevent a recurrent venous ulcer. Use a long-term to prevent the recurrence venous ulcer. The use of the long-term compression is important. Compression socks, you know, those socks like it's compress your legs, is very important to prevent that. And then elevation of your legs, it's very beneficial. Or then exercise also, it's very important because it's going to encourage the improvement of the calf muscle to pump blood up. So it's very important. So thank you so much for watching my video.